Hello everyone and welcome back to my YouTube channel. My name is Alot and I am a physical therapist. In today's video, I'm going to start a new series. This will be a different kind of videos that I am going to be talking about. This is about learning massage while you are in quarantine. Although this is not what we do in physical therapy, but like I said on my previous video, I do have a very extensive experience and training regarding massage therapy when I still used to work as a spa therapist from before. So I am so excited to share it with you. It is still going to be a series so that you will have time to learn the techniques and the strokes that I am going to be showing you. This is a very good idea for you to learn while we are in quarantine. It's not going to be so difficult. I'm sure it's going to be a whole lot of new experience for you to some who wants to learn about massage therapy. If you're new to my channel, please consider subscribing, as most of the videos, like I said, is part of a series, and hit the notification bell so you'll be notified when the new videos are being uploaded. So let's do it. So, okay, before you uncover the back of the patient or your client, you're just gonna introduce some movements while he is covered by doing rocking on the pelvic area. Should be just soft, not too much pushing. Then you're gonna do side stretches. You just have to gradually introduce the pressure and not dig in right away. And then you are gonna do that as well. Run along the whole back. Make sure you don't press the spine itself all the way to the buttocks area. Now you're ready to uncover your client. At this point, make sure that there's still like a decency. Doesn't matter if your husband or your client, make sure that you're doing proper decency and just expose like the upper buttocks. Tuck in as well properly the towel or whatever it is that you covered for the patient. Now ideally you're going to warm up the oil with your hands. And you're going to start touching the skin of the patient or the client. Now this one you just have to spread the oil. This one doesn't really have to have pressure on it the first time. You just have to make sure that he is, or your client has enough oil on his body. And you, as the person who give the massage itself, make sure that you are also in the proper body mechanics. You see, even if you're doing the massage without the massage bed, you're still making sure that you don't hurt yourself too. So you can put your leg on the other side. This time, keep your arms straight and just use your body to push and glide to give that first pressure to your massage. And then you're going to do it again. Right. See, I use my body in, when I glide, to make sure that I have enough force, but not just using my hand to push, to put that pressure on the back, but use my body. Now this one is you have to use the knuckles. You just have to run through along the paraspinals, all the way to the base of the neck. Slide and slowly come back down. You see, I have a very good balance. I've been doing this for a long time. The knuckles of your fingers is very good at releasing those tensions along the paraspinals of your back. I usually do it for about 3 times, 3 repetitions, and make sure that you could also ask your client if the pressure is just enough for them. Some people just can't take the pressure during the knuckling right away. Now this, you're doing kneading by using your thumb. This one is run along the pelvic bone. It's where you have those attachment of the muscles in the buttocks, and also some bigger muscle that is attached to the pelvis from the lower back muscles too. See, make sure that you also do that on the paraspinals. Then you just make the necessary adjustment of your body as well as you do that. If you could observe me doing it, I always keep my arms as straight as possible, but not necessarily locking the elbow too. Just to make sure that I use my body to do the pressure and not my arms. Okay. Now this, you gotta go run along the spine itself, but not on the tip of the spine. If you run your fingers along the middle of your back, you will see these bones, almost like sticking out. So beside those ones, those are the ones that you're gonna release those muscles to. Then you could sweep one side of the body and then release those tensions on your shoulder blades or your scapula. There's a lot of muscle attachment on the scapula. There's your rotator cuff muscles, there's your rhomboids that is attached, and then trapezius as well. And those are very important scapular stabilizer. Oops. Okay, I'm doing something like acrobats in there. But I make sure that I have a very good, proper body mechanics. So I could give, my very good energy towards my patient, but not also like I am sucking his bad energy. I'm just trying to release it, away from both of us. You probably will feel like difficult the first time you're doing it, but you'll get your pacing later as you keep on doing this one. You will practice with your husband or with your wife or anybody close to you. This one, there is a pressure mostly on the tip of the fingers as you run through on one side of the body. This time I'm doing raking. Still the same. The pressure is pretty much more on the tips of the fingers. This is a very good release of those muscles as well. Slide down. And then this is what I call milking. It's a form of a kneading technique wherein you push and counter pull the same time with those bigger muscles in the back. I'm really sorry about the camera. Just keeps on like blurring sometimes, and then it's gonna clear again. But nothing to worry. You still can see it even if it's blurring sometimes. This stroke is what I called skin rolling. So it may be like so simple to look at, but the pressure is on the thumbs, while the other 4 fingers are kind of like rolling the skin. Even if the technique itself is called skin rolling, but the thumb is actually deeper than just the skin. I forgot to tell you, this is pretty much like a Swedish type of massage. More in relaxation, as we call it. So it's not really like so deep that sometimes you're going to use the elbows. So these are all just relaxation type of massages. Even if you use the knuckles, it's not really like, it's way too deep than when you use the elbows or the forearm, which could be considered as a deeper tissue massage. So if you observe how I transferred, you still have to keep your hands on the patient's skin or your client's skin. I keep on saying patients because I'm doing physical therapy now. When I was doing a spa therapist before, we keep on calling clients, and when I started going back to therapy, I keep on calling them clients. But mind you that this is not what we do in physical therapy. This is what I do when I am doing massage therapy. My husband's lucky enough to receive that, treatment every time. Where he worked hard too, and he deserves it. My husband has a lot of back tensions. I can feel it. But I used to give him like a deeper tissue massage. But this time I'm just showing the Swedish type, which is the relaxation one. Okay, going back to knuckling again. I guess when I feel like there's specific muscle group that I need to work more, this time I think I have observed that he had more tensions on the paraspinals. Now I'm going to the upper body. I'm sorry again for the changes of the camera focus. All right. Me as a massage giver, I'm still kneeling at this time. But probably if you have a longer arm, hi. Probably if you have a longer arm, you could take a seat. then you could reach. But I like it when I'm kneeling because I could put pressure on it. Even if I'm like slanting, I still use more of my body to kind of like release it. Now this technique is what I call the circular technique for releasing the knots. Sorry, I can't see it properly. Okay, there it is. I could use now with just one thumb, but for you, if you're just starting, you could use both thumbs, like stacking one another, or you could use both thumbs besides each other to kind of like release those knots. What you're gonna feel for knots are, it's very like circular type of tissue that when you pressed on it, you would the person would feel like there's a radiation of pain around it, because trigger points, what we call it, have referred pain. So if you feel that the circular tissue in one spot, you pressed on it, you probably will feel it a little bit farther away. So I'm using knuckling as well, still focus on the upper back. Now this is pretty much more on trapezius muscle, a little bit more on some of the supraspinatus as well. And then I'm going back down. Later on, I'll do a little bit more massages on his neck and upper back when he is already in supine position or lying on his back, when I'm doing the chest and head massage, which I will be showing you later on. Right now I'm focusing on the pelvic area. Used my knuckles and used my thumb as well to release those tensions. You would be surprised like how feeling good it is, because there are some tensions on the upper buttocks muscles too, especially if you have a lower back pain. This is a very good technique. Now I'm back to effleurage. I think I'm about to finish. Yeah, it was fast. It's more than 15 minutes of massage, but it feels like it's a little bit faster. So you always start the massage with an effleurage stroke, like this one that I'm doing, and you also end the massage with that stroke. There you go. Now you can cover. I always make sure that my client is fully covered. Then you're gonna introduce pressure again. And then this is what we call hacking, or otherwise known as your tapotement, whatever it is, however you pronounce it. I just call it hacking. So you just have to, let loose of the fingers when you do that. Not really like so stiff, because when you do it like stiffly with that hacking, the pressure from when you're doing it goes through your arm. So if you just let loose and let your fingers just stackingly hack the back. So at this point, I'm just introducing the pressure now all the way to the ankle, and then release those bad energy.